Dr. Malone, Joe Zarzaur here for another COVID update. We're obviously doing these a lot more
infrequent.
Thank you. And we're at the end of week 10, unless I missed 10 and we're in 11, but I think we're at the end of week 10 since we went remote with the staff, or most of the staff. This week has been somewhat more normal feeling downtown here, pretty much normal. I did think that it justified us having another one of these updates because there's some things that, again, just like last Friday, there's some things that happened this week that I think are newsworthy enough for us to want a doctor's perspective, from a local doctor's perspective, of things like hydroxychloroquine. What is the deal with hydroxychloroquine? Should we be asking our doctors for it or not? If you're not in a high risk group, you're not in the hospital. The other thing that I thought that we might want to talk about a little bit is, I guess yesterday or this morning, I'm not sure when this happened, but I think the Lancet came out with some more information on hydroxychloroquine. There was a study, more study on the vaccine, and anything else you thought that we should talk about? You know, I'm still hearing from clients locally who are having issues with Southern Oaks. Is that the name of the facility?
Mm-hmm.
They sound like they've got a pretty good situation over there with positive cases. I know they're trying to manage it as best they can at this point, but I think some people are getting frustrated. Family members are getting frustrated with the flow of information from that facility. Anyway, give us some medical perspective, please, on the week's highlights.
Well, I'll start with this here for the local numbers. I won't bore people with all the other numbers from like national and all that stuff. So the state's we'll link this file as we've always done here. So the state's got a pretty good one-page summary for each county, and we'll link the whole file. But kind of shows you the trend here for the confirmed cases per day in Escambia County. So you can see those numbers there.
Are we gonna put a link to this so people can look at it? Okay, great.
Yeah, we're gonna link it. But are you able to see that, Joe? Or
yeah.
Okay, yeah. So it shows kind of the day to day. Got little blips here and there. But, overall, if you remember back before in April, there was days where it was like 40 new cases and, just outstanding amount of cases. So amount of new cases per day. And so when you look at that, you say, oh, well, we must not be testing as much, and that was one of my thoughts, admittedly. So then you scroll down here and look at how many people are being tested. A lot more than I actually thought. So look on May the 19th, 1,100 tests. 800 tests on the 20th, and then so it's not because there's no testing. Back on May 15th there was the 26 tests, so you have to look back and say what was going on May 15th. That was Friday. Maybe there were.
Somebody raised the question. I saw a story on one of the news channels today when I was working out that they were talking about contact tracing. I think it was Patterson, New Jersey, where I guess one business decided they were going to just do contact tracing. Do we have a local contact tracing source? Like, is there anybody that's doing that on behalf of the county?
Not that I've not seen it, and it's not been publicized. I've been reading the county updates every day. And if it's happening, it's not being broadcast at all.
It seems to me that if you're going to open up, I'm frustrated. Okay, as a business owner, I'm frustrated because I'm tired of working remote. To be honest with you, I don't do well unless I'm face to face, as you and I talked about this week. I don't feel like I'm working unless I'm actually in front of somebody. I don't know why, but it seems like we've been doing this for a very long time. I frankly don't know anybody that has had the virus personally. I don't know them. I know of people locally that have had it, but I don't know anybody personally in my small group of friends and relatives here that have had the virus. So who has the virus? Like, where are they coming from? How did they get it? Is it all from just the one or two locations in town that like, I wonder if all the cases in Escambia County all came from the long-term care facility and the people that were associated with that long-term care facility, or were there batches of it elsewhere? Like, why is there not like a heat map in Escambia County that shows where all the cases are?
Well, and so you brought that up on that sheet that I just had up. It's, you know, there's 740 cases in the county cumulative over the 10 to 12 weeks. And of those, 250 have been associated with long-term care facilities.
Where are the
So
other 500?
40%. So yeah, where's the other 60%?
Okay, yeah.
And
So, or of the 60%, are there clusters that are surrounding a particular area of town or business? Like, that's something I'd like to know. Did they trace it back to people hanging out at Fort McCree? Did they trace it back to people hanging out at a bar? Did they trace it back to people at a field or at a tennis court? Can we figure that out? Like, it would help a business owner to know so that they can tell their staff, look, don't worry. Don't go to any hot spots. Here are some hot spots that we know about in the county. Don't go there. Don't go near there. Don't be around anybody that has been to those places. But we'll see you here on Tuesday wearing your mask and keeping your social distance and wiping down counters or whatever. I mean, I don't have any information like that to go on. There's no testing that can tell us anything reliably. Like, you can get tested tomorrow, but it doesn't, and if it's negative, that doesn't mean that that person didn't have the virus. It just wasn't manifesting itself yet, right? So
yeah,
how in the hell are we supposed to manage? The White House can't manage that. How are we supposed to manage that? And they've got all the resources in the world at their fingertips, and they can't keep the virus contained. So how do you ask a business to do that? Except to just tell people, and this is what I've sort of resigned to, look, you're all young. All the high-risk people in my office are staying home. So if you get it, you're probably just going to have something that at worst is like the flu. Is that what I'm supposed to tell these people?
That's not far from accurate.
Okay. Well,
yeah.
I feel bad about telling people, well, you might get sick, but come on to work. I mean, but I guess that's where I am now. So, because I'm not getting really a lot of the FaceTime that I need with some of my staff. The work's still getting done, but I need FaceTime with lawyers and paralegals so I can strategize and hash out stuff, just like you and I did earlier this week together on a malpractice case. We did that hashing out, and we made a lot of progress.
Yeah, I think we did 8 hours of virtual work in about 3.5.
No doubt.
In the office.
No doubt in my mind. So, what else did you have for us today, Dr. Malone? Sorry about that for that tangent.
Yeah, not a problem. Yeah. So you had mentioned at the outset here the hydroxychloroquine study from the Lancet, and this is it. And I'll show you the. Yep, we'll link all of them. So the interpretation here is at the bottom. So this had 96,000 patients.
Which was a lot.
Oh, that's a huge study. So,
right.
You know, we shared a lot of studies over the last 8 weeks where it was like 12 patients or, 20 patients. And there's like these little tiny, like, hey, like this is a stepping stone. Let's do another study based on this. Well, this is a huge study. It was well done, and it was observational, meaning they didn't take 96,000 patients and give them hydroxychloroquine. What they did is they went back and found 96,000 patients who had been given hydroxychloroquine and tracked what their hospital progress or track ended up being. So a couple of things. One, it was people that were in the hospital. Two, they were already given the drug and their course had already been played out. So this went back and kind of did like a post-mortem analysis of it all, because a lot of these people did die. And what it found is that there really was no benefit for these people in the hospital. Some of them fared even worse, though they weren't able to directly attribute it to the drugs necessarily. That's one part where the study is saying, hey, we need to be a stepping stone. Someone needs to take this further. And then lastly, there was an increase in dysrhythmias that we've been hearing in the news with both of these drugs, where it can prolong your QT interval and cause the ventricular dysrhythmias. Those are the ones that are usually not as innocent and not as compatible with life. So anyhow, same thing. They didn't also link the arrhythmias to death. So it's not like they said, hey, we had all these people that died of the arrhythmia. They died, and by the way, they're in and out of different arrhythmias, but we don't know if that was the direct cause of death. They may have died from kidney failure for all they know.
Right.
So important thing here was the hospitalized patients who were being treated for acute illness, not for prophylactic. And also there was other comorbid conditions there.
Right.
So the next study would be, hey, we want to get 100,000 people who took this prophylactically, who are ambulatory in the community, and see what their outcomes would have been. I think that's what I would like to see.
Yeah, but I think the problem with that, Evan, is that since the disease is less and less predominant, how do you know it's not just the person didn't come in contact with somebody because it's not around anymore, versus they came in contact with somebody and it was resistant to that contact?
Yeah. And
it's a perfect time to start taking any drug and claim it's going to defend you, because the numbers of infection cases are going down. So, I mean, you got a pretty good chance of not getting it anyway.
Yeah, no, I agree. And I think some of this is also planning for the future. So if there's another wave, how do you treat it then? Do you have to start treating it sooner? I mean, I think that's what all these studies are looking at. So
I think all this is crap at this point. I think we need to be working on a vaccine, right? And because at the end of the day, we can do all this research they're doing on this hydroxychloroquine. We should be putting those scientists on a vaccine, because, I mean, maybe they can derive something from the hydrochloroquine that can help with the vaccine, but I think we've seen enough to know it's not a miracle drug for sure. Right?
Yeah.
All right. So I also saw something from the CDC yesterday, and it may have been a misleading headline because you've already told me that it might have been somewhat misleading, but I think if I fell for it, I think a lot of other people could have fallen for it, but it said something like, surfaces are not where you get the virus. Don't worry about surfaces anymore. Worry more about the particles in the air. And you said, when I told you that earlier today, you said, well, that's like a misread. I actually read the study, which thankfully somebody's reading the study here. That's why you're here, to tell us what the actual CDC study said about surfaces. Are they pulling back and saying you don't need to wipe down your groceries anymore? Or are they saying that?
Well, what they're saying is it wasn't a study. They're basically just changing their guidelines. So this is right off their website, and we'll also link this. And so they're saying that of all the cases that they're tracking, I guess, it's person to person spread. It's through aerosols. That's if they got 100 cases, the majority of them are coming this way. It's not to say that you can't get it from surfaces. So if you look at this top part here, person to person spread, but at the very bottom, they still leave this on here. The virus does not spread easily in other ways, though it still spreads this way. So it's not to say ignore cleaning your surfaces and all that, but if you're cleaning your surfaces and you're not wearing a mask, for instance, or you're cleaning your surfaces and you're then sitting right next to someone, it doesn't matter how clean your surface is. You're still going to get it from, or potentially get it from, the person who's sitting within a couple feet of you. So, that's what that meant. And, the headlines went with, like you had mentioned, surfaces are not a problem anymore. Just stop doing that. And I think that was a misinterpretation of their guidelines.
How much does the mask help percentage-wise?
Good question. So it helps to a certain degree, and people are trying to put numbers on it. And here we go. This is a Chinese study.
Uh-oh.
Yeah, I know.
Suspect.
So a couple things. This has not been peer reviewed, and they did it on hamsters.
Hamsters?
Hamsters.
All right. Is this a real study, though?
Yes.
These doctors? Okay. All right.
Yes. So what they did is, and we'll link it here for people, but I'll give you the synopsis of it.
They put masks on hamsters.
No, on cages. So this guy. So this is what they did: is they caged. They wrapped a mask around a cage or over the ventilation duct that goes into cages, and then they had some without ducts or without the mask material.
What kind of mask? Like N95 or like cloth?
No, it was like medical masks. I think they did some N95, and they also did just like the cloth masks.
Okay.
And so that infected hamsters, and again, you're looking at hamsters, not humans, but they said that the transmission could be reduced by 50% when surgical masks were used, over these vents that would ventilate the area where all the cages were. And so they actually had infected hamsters on one side and then uninfected on the other side, and they were seeing what the transmission was. The other thing they found out was that how extreme the illness was in the newly infected hamsters on the other side of the mask, it wasn't as bad. It's almost like the really, really bad viruses were getting filtered out, and like the ones that were making it through were like the weak ones anyhow, and they got sick, but not as sick.
Wow. That's an
so
interesting
anyhow,
thing. So
yeah,
the bigger the particles are of the virus, the more potent it is in the body. Is that what they're suggesting, or the hamster body?
Or it may have to do with the receptors on the virus,
Okay.
any number of things. But they found that this mask material, if something got through, it wasn't infecting the newly infected hamsters as badly. Anyhow, so a couple of the ways that they played around with their numbers is they saw anywhere between 50 and 66%, and even up to 75% of a decrease in transmission with the mask material, whether it was over the cage itself or over the ventilation that leads to the cage. So that's something that, again, it's not peer reviewed, but they're trying to parlay this into, what in a regular setting for, humans moving around in their day-to-day, is this going to translate to?
Right.
So I think it's something to further explore. In the meantime, properly wear your mask. In fact, this gets rid of the idea of needing to properly wear your mask, just any kind of covering over your mask, and to know that, like you cover just your nose or just your mouth, you're covering part of it. And that's kind of what they did with this study.
Okay. So if people are going to work on Tuesday, nobody's going to work on Monday except the essential services because it's a holiday, and we thank them for doing that. But on Tuesday, when other businesses open, and I think a lot of them are going to be like wide open on Tuesday, what do you tell employees that are afraid to go to work? How do you tell them to keep themselves healthy at the workplace? What do they need to bring with them? What practices do they need to employ once they get there? What would you tell them?
I would have a mask available for use if you're going to be within the, a radius of someone that's 6 to 12 feet, really. So that's number one. And you can't stop people from like walking by your office.
Right.
But if you know that like you and I are going to sit there and meet in the conference room and we're within range of one another, we should probably have masks on, kind of a
All
thing. Right. But if you're upstairs and I'm downstairs, we can both have our masks off. The other thing is still maintain the hand washing and cleaning your surfaces and all that.
Okay. If somebody comes to the office that you're going to, and you're at your desk and you hear somebody come in the door on Tuesday and they're coughing, what do you do?
I don't think I wouldn't be happy with them being in the building at all. I would try to stop them from coming in further and say,
shouldn't every business have some kind of policy about taking temperatures and somebody can have a cough and have the virus and not have a temperature. So if they have any symptoms of the virus, shouldn't they excuse themselves home so that not everybody else is contaminated? Something like that?
Yep. Oh yeah. Like my nightmare is, on the one time a week I'm at the grocery store, is that the person in the same aisle as me coughs or sneezes. I don't know, like do a U-turn and go the other direction real quick.
Right. So I've had people, potential clients call me. They work at restaurants, businesses. Somebody's on staff there that's coughing up a storm, and the employer won't do anything. And finally, they made the person go get tested, but that takes 3 days, and everybody on the staff is thinking they're going to get sick while the person's out. There's not a lot people can do about that, right? There's just not a lot. I mean, legally, you can't really do anything. Medically, you can try to keep everything sanitary. And I guess what you do is you wear the mask and decrease your chances of getting the virus by 50% or more, right? Yeah.
Mm-hmm. And so if the person that sneezed or coughed has a mask on, it's limiting their transmission outward. And then you have a mask on, you're limiting your transmission inward. That's how they get up to 75%. It's like additive almost.
And then I frankly think you should make a document to the human resource person an email to the owner that says, so-and-so came in today, he's showing symptoms or she's showing symptoms, I'm not comfortable here, especially if you're high risk. I'm not comfortable here, or have somebody at home that's high risk because so-and-so is at home and they're high risk, or I don't want to get sick because I'm the primary breadwinner for the family, and if I go down for 3 months with the coronavirus, we're going to be financially ruined, whatever. The point is, you need to probably document that. So I know that you don't care about that as much as I do from a legal standpoint, but I think the businesses should be responsible in that regard. So sometimes a document may force somebody to be responsible when they otherwise might not be, right? You don't have to comment on that. All right. What else, Doc?
Those were the big ones. And then I guess I just want to remind everybody that in the county, 25 deaths as of 2 o'clock this afternoon, and 18 of them were associated with long-term care facilities. So
wow.
Again, I see that as a combination of good and bad news. Good for the people that are ambulatory and in the community, like you're not going to die from this chances, but bad in that the people that reside or work at these facilities, you feel bad for them,
right,
having to have any contact with a place like that.
Yeah.
So
and I think people don't need to get a humongous false sense of security at this point, because 2 days ago, the mayor of Montgomery, Alabama, which is not a small town, was on the news basically saying we have 1 ICU bed left.
Mm-hmm.
And they were shipping coronavirus patients to Birmingham. Now, I have a suspicion that if somebody got on the news here, if the mayor got on the news here in Pensacola and said we only have 1 ICU bed left, that would scare a lot of people. I would be scared. And so we need to be paying attention, need to be smart, stay in touch with the news over the weekend and next week. And hopefully somebody's doing some contact tracing or some version of it, or locally, I hope. Somebody should volunteer to do that. Hell, I'll start volunteering to do it. If we get the information and can confirm it, somebody needs to host some kind of site that would allow for that. But I have noticed an uptick since people are driving again, and unfortunately car wrecks. It's like you turn the spigot on, and as soon as the spigot's on, it's on full blast, and people are slamming into each other, acting crazy, drinking and driving. Be careful, folks out there. People are acting, like they've been caged animals, which we've been for a while. So be aware of that. Don't be afraid of going to the hospital if you get in suffer a traumatic injury. They're all set up to deal with coronavirus on this side, and they have regular non-coronavirus on this side, and they've had months now to handle this flow. Okay, you're not going to get coronavirus by going to the ER from a traumatic injury. Okay, do that anyway. Okay, also chest pain, stroke symptoms, all that run-of-the-mill stuff. I was talking to a cardiologist last week who was telling me they're not showing up at the hospitals. And Evan and I talked about this early on in the virus. 30% of the public is not going to the hospital when they ordinarily would, and some of those folks are dying at home. So if you have chest pain, go to the hospital. You're not going to get coronavirus. If you have stroke symptoms, go to the hospital, ER. You're not going to get coronavirus from going to the ER. So long and short of it is, y'all be smart out there this weekend. If you're at Fort McCree, I know it's beautiful probably this weekend. I know it's going to be gorgeous out there. Be smart. Like, stay on the boat with the people that you came with. Don't mingle with groups and large groups of people on the sandbar or the sand. Try to sort of stay contained. Don't get within 6 feet of somebody if you have the option not to, right? Talk to somebody from a little bit of a distance. Do those things. If you have hand sanitizer on the boat, use it. So anyway, but everybody needs to have fun too. I'm not saying you shouldn't have fun, so have fun. We'll be here if you need us. Zarzaur Law on the web, zarzaurlaw.com. You can find us that way, or you can call us at 855-HIRE-JOE. We're on every other social media site too, as you already probably know. Anyway, thanks for tuning in. We'll see y'all next week. Thank you.
All right. Bye now.
Thanks, Dr. Malone.